everybody, welcome to my channel, The Ready Nurse Nay. Today's video is a story time video where I'm going to talk about the scariest unit I worked on as a nursing student. Okay, so if you do not know, I am a senior level BSN nursing student. I literally graduate in 2 months with my BSN. Your girl will be out of here. So I'm taking a trip down memory lane in some of these videos, really talking to you about some of my first experiences and different things as a nurse. So like I said, today's video is the scariest unit I've worked on. I have a few videos on my channel about it, but you can go check it out, whatever. But here, this is just a quick video. But the first time, my scariest unit I've worked on as a nursing student was definitely the ICU. The ICU was my scariest unit I've worked on as a nursing student. Okay, why? For one, you have all kinds of like health equipment and machines and stuff that it's your first time being introduced to them. They're not on like all of the med-surg units, and for my school we do med-surg basically every semester. So some of the different equipment was my first time being introduced to some of the equipment, the different practices and the different way they do things. That's my first time kind of being introduced to that. These patients, because this is the ICU, intensive care unit, these patients need intensive care. Okay, if you're on the ICU floor, you are sick. You are sick. And so that can be scary, dealing with patients who may be literally on the brink of death. Literally just coming out of open heart surgery, brain surgery, big time surgeries, and they just got out of them yesterday and now they are recovering in the ICU. That can be scary. Yeah. So let's talk about it. So at my school, we do 3 weeks of clinical rotation on the ICU. So my very first patient on the ICU unit was a kind of middle adult male that had kind of a complicated health history, and I forgot the specific reasons, was in the ICU, was on a ventilator, was on had an arterial line, had IV lines, peripheral IVs, IV lines, also was on dialysis, and all these other different equipment. And then to top it off, was also on isolation precautions. So on this ICU unit, they have to have vitals every hour, and they're automatically taken, with all of the stuff hooked up to the patient, they're automatically taken. But you're also checking on your patient more frequently as well, because it's an intensive care unit. So because this patient had isolation precautions, every time we went in this patient's room, we had to dress all the way up, put on our mask, put on our gloves, put on our gown, and then go in there and do what you gotta do. So yeah, but I would say it was scary because this was my first time, I guess, like seeing somebody being hooked up to all these different things. Like I said, this patient was on a ventilator, this patient was on all these different things, and then we're going in there checking. It's my first time being introduced to this. So the nurse, showing me, explaining different things to me, and doing these different things. But at the same time, she's getting orders from a doctor to do stuff, right now, and to get this done. So she's moving. But I think what really kind of stuck with me for this patient is I remember looking in this man's eyes, and I could just look at his eyes and see, like, it was like he was reevaluating his whole life. He was like, man, what I done did to get here. If I get out of here, I'm gonna do X, Y, and Z differently. I was, and it just made me have so much, like, I felt sorry for him, so much. The tube, I don't know if an intubation tube, it's thick. It's thick, and it does not go right here. It goes deep when a person is intubated to be put on a ventilator. Like, they're intubated, the tube is, thick. They got different sizes, but it's thick. It's thicker than a straw. And it's hard plastic, and it goes all the way down, all the way down, all the way down. And right there, in that connection by the lungs. And it's the ventilator, depending on the setting, is forcing air into your lung and out of your lungs, depending on the setting. So that is uncomfortable. I mean, I've never been vented before. I don't want to be. But imagine somebody forcing you to take a breath. So it's uncomfortable. It can be a little painful. He had the NG tube in him, all these different lines and stuff, you know, pulling on you. It's uncomfortable. It's uncomfortable. So it just made me feel kind of sorry for the patient. I know that's what had to be done in order for the patient to heal, but it just makes you feel sorry for the patient. So I think with all of that, being introduced to new equipment and new things was scary, but also looking in that patient's eyes and seeing, you know, him like just thinking like, how did I get here, man? And then because the patient was pulling on the tube, you know, and pulling on the lines, they had to actually like restrain the patient and put restraints, wrist restraints on the bed, you know, and they had orders for it. Okay, there were orders for it because he was pulling the tube out, he was pulling stuff out, and so they had to restrain him. And so I was like, oh, I mean, that's just, I had great sympathy. I felt, you know, for that patient being restrained and having all this stuff on him, you know, and he was still with enough, you know, to nod his head and things like that, so he knew what was going on. But I had great sympathy for that patient. They did dialysis in the room. It was my first time seeing that. Connected up, did dialysis to the patient in the room, and we're doing all these different things. But that was definitely my scariest unit I worked on as a nursing student. I guess looking back now as a senior level nursing student about to graduate, because I know more now about, you know, not everything, but I know way more now than I did then about ventilators, the settings. I understand it. You know, as a nursing student, I like understand it, the vent settings. I understand the different lines and different things of what you're monitoring and you're measuring. If I were to go back now, I'm more confident about like how to take care and monitor those different things. But so I don't think it's that I could have did anything different, but I guess now because I'm more aware of like what the equipment is and how to monitor it, I would go back in more confidently. But I still would have that sympathy for my patient, looking in their eyes and seeing, you know, that they're like thinking about their whole life and how they got there. So, but yeah, it was still a good experience, a learning experience. I would say what I learned about myself is I think even though like I was scared, I still was able to finish my shift and do what I had to do as a nursing student because I had no choice. The stuff that I didn't know, I was able to find out and figure out and learn more about it. So if anything, the experience just made me a better nurse. But yeah, that was my scariest unit I worked on. So what was y'all scariest unit y'all worked on as nursing students? Let me know, because it may be different for y'all. Y'all may love ICU. That might have been your funnest clinical experience. But yeah, tell me. So what was your funnest clinical experience? What was your scariest clinical experience? Drop them in the comment section, like, comment, subscribe, and I'll see you on the next video. Bye.